It's okay.
Hello everyone, welcome to another video. I'm Dr. Rishabh Jain, and in this video we'll talk about neurosurgery as a branch post MBBS. So there are few courses in both INI-CT and NEET PG in which 6-year neurosurgery is given as an option for a specialty training just after MBBS. And so in this video we'll discuss about the neurosurgery as a career, the residency, the working hours, toxicity, future prospects and salaries, as well as the academics, if there are in a neurosurgery residency program. So today I have with me a very special guest, Dr. Sachin. He's a 2011 batch AIIMS Union. He's 1 year senior to me, and he's currently pursuing his neurosurgery residency from the prestigious NIMHANS, Bangalore. So hi Sachin, how are you?
Hey, I'm great, man. Hi, Rishabh. Good to see you after a long time.
Yeah, I know it's been a very long time.
Yeah.
So Sachin is currently pursuing his 5-year neurosurgery residency program at NIMHANS. So
Yeah.
in this video, I'll talk to him about how his experience of neurosurgery is and what are his insights into this field. So Sachin, so brief introduction about Sachin. He had an All India rank of 7 in NIMHANS Bangalore, and he wanted to do neurosurgery, and hence he pursued it from NIMHANS. Sachin, how is neurosurgery as
Yeah.
a branch according to you? What does it entail, and why did you choose it?
Yeah. Yeah. So, neurosurgery is like a very different branch. I mean, it is perhaps one of the most glamorous branch when it comes to layman perspective. So, if you
Right.
ask any topper who has just got into the MBBS course, they would say that they want to become a neurosurgeon or a
Right.
cardiothoracic. It's like
Right.
a routine thing to say. But over the period of MBBS course, many people realize, what they want to do, and many people drop out. So very few people join the course finally. So neurosurgery as a branch is very difficult. So it is one of the most difficult courses to pursue as a doctor. In fact, because most of the case, there is a lot of complexity involved in the surgical procedures, and it is not just a surgical branch. I mean, you have to be a very good physician. You have to be a very good new surgeon. You have to be a very good administrator. There are a lot of things which a neurosurgeon has to be a part of it as a part of his career. So long working hours, good stamina, an ability to do administrate. An ability to manage people, patients. So there are a lot of things which is required for a neurosurgeon. So the branch itself requires a lot of dedication. So if you have if you want to keep your profession as a part of your, just as a part of your life, and if you want to have a certain bit of free time and everything, neurosurgery will be a difficult branch to choose. But but saying that neurosurgery is a very satisfying branch, as in you will get to see save a lot of patients. You get that adrenaline rush and adrenaline kicks, and that that moment of intense satisfaction which you get when you save a life or do things like that. That is what makes us continue and pursue this branch further, despite the long working hours and the hardships which we have to face.
Right.
So
Right.
I usually compare it to riding a Formula One car, as in you have to make split-second decisions. There'll be a lot of turns, this thing, and you get to know the difficulty, the speed when you crash somewhere. It is something like that. So when things get complicated, you understand how difficult. You rethink why you've chosen the branch. But it is people who are adrenaline junkies. It is a good.
So, what are the subspecialties in neurosurgery?
Yeah, so the neurosurgery itself is a very broad branch. So it deals with the problems of the brain and the spine. So there are problems of the bone. So spine. The skill set required for various branches of neurosurgery are different. The specialties are very different. So based on that, we have different subspecialties. So skull-based surgery and vascular surgery is one branch, which is considered as one epitome of a neurosurgeon. So it takes a lot of skull-based surgeries are basically, they deal with the tumors of the skull base, generally with tumors and vascular malformations of the skull base. So
So,
it
for
requires a
example,
lot of skill, and it takes time to develop the skill. So this can be done as there are fellowship courses available both in India and abroad. So you can do these fellowship courses to get specialized in training in skull-based approaches. But you can do over a period, but it takes usually a period of around 5 to 10 years to become an expert skull-based surgeon. Most of these skull-based surgeons which you see are mostly above 40 years of age. So it takes time to become a very good skull-based surgeon. So, but it is considered as one of the most glamorous branch among neurosurgeons. But again, it comes with a toll of it requires great amount of skill, a lot of stress, and all these things. So that is one branch. So coming to the other branch, spine. So spine surgery is usually divided between orthopedic surgeons and neurosurgeons. However, usually in majority of the centers, cervical spine and especially CVJ problems are dealt with by neurosurgeons in particular. The lumbar spine is shared between neurosurgeons and orthopedic surgeons. And when it comes to problems within the dura, like interdural tumors, intramedullary tumors, only neurosurgeons operate them. And most of the spine cases per se in private practice, 80% of your neurosurgery practice is spine. So spine itself forms a very important part of your practice. The outcomes in many of the spine tumors are pretty good, especially AIIMS like schwannomas. So you get to do a lot for the patients, and you can cure the illness, and they can, even bedridden patients can walk after the surgery. So it becomes a very promising area of, it's a very good pursued area of neurosurgery. That is another specialty. So skull-based surgery, spine surgery. Then comes pediatric neurosurgery. Then again, you have to compete with the orthopedic surgeons in cases of spine surgery. Then there's another subspecialty, which is pediatric neurosurgery, which deals with the problems of the pediatric patients. The uniqueness about these patients is they have a very low blood volume, and the problems are very unique. So the amount of this kind of skill set required for pediatric neurosurgeons are very different. So this again comes as a fellowship course, which can be done, which is again available in many centers in India. So they deal with problems, specifically like problems like rhinosinusosis, hydrocephalus, problems of CSF pathway, pediatric brain tumors. So they come under pediatric neurosurgery. So then again, you have a functional neurosurgery, which is a very promising upcoming branch. So you have they deal with treatment of Parkinson's, deep brain stimulation, which is a very upcoming branch. So there is a lot of money also involved in deep brain stimulation. So functional neurosurgery is another important subspecialty of neurosurgery, wherein it includes deep brain stimulation surgeries, then stereotactic surgeries, and even epilepsy surgeries. And the thing about the thing common about all these surgeries are that they're very satisfying. Actually, you can cure the illness. If the patient coming with MTS, you do the surgery, next day patient stops having seizures. These are, if with proper patient selection, and then again, you are dealing with normal anatomical structures in epilepsy surgery. So the skill set required for these surgeries are very different. And you again have to work with a team of neurologists when it comes to functional neurosurgery. And then again, a lot of money is involved. So people who are interested in that can do. Then most of these surgeries are anatomical surgeries rather than skillful surgeries. So functional neurosurgery is a kind of surgical branch which can again be pursued by neurosurgeons. Then comes endovascular surgery, which is again an upcoming branch in neurosurgery. Endovascular procedures is shared between radiologists and neurosurgeons. But then again, in endovascular procedures, it is the future when it comes to vascular problems of the brain and spine. So that again is pursued. You have competition from the radiologists, even from some neurologists. But I believe that for emergency endovascular procedures, maybe neurosurgeons might be better, because we are trained to handle emergency. So in the night, 3 o'clock, 2 o'clock, whenever you get a call to handle a case of stroke or anything, it is quite possible for us to rush and reach the hospital and manage the emergency. So that is again another subspecialty. So and trauma neurosurgery doesn't come as a separate specialty, but again, some people do only trauma surgery. So in neurosurgery, so these are the different subspecialties in neurosurgery. But what I would like to, neuro-oncology is another subspecialty, but it is shared between other subspecialty of neurosurgery. So neuro-oncology is another subspecialty which can be pursued. But what I mean to say is the skill set required for every neurosurgical subspecialty is very different. What I mean is you have to be an orthopedician when you deal with the bony problems of even brain and spine. You have to learn how to fuse the spine, and you have to think and work like an orthopedician. But when it comes to skull-based surgery, the skill set required is completely different. When it comes to functional neurosurgery, the skill set, you have to be a mathematician and a very good neurologist when it comes to that. So that is why neurosurgery is you have to be a lot of things at the same time when you have to practice the art of neurosurgery.
So
Very exciting.
Yeah. So do most neurosurgeons pursue a fellowship course?
It basically depends on where you want to work. So if you want to work in a setup as a single neurosurgeon operating general neurosurgery, it is never required
Okay.
fellowship courses. Okay, but if you want to settle in a place in a city like Delhi, Mumbai, or even for that matter any major cities, second tier cities in India, it is and like I told, the skill set required for this subspecialty are very different. Say maybe maybe my skill set required for spine surgeries might be different. I might be interested in spine surgery when I start my practice. So if I want to pursue a career in spine surgery, fellowship courses might help. It is not a must, but and then again, in many corporate hospitals, new corporate hospitals, if you have a fellowship, they can they can put you. It can improve your CV, and they can put you in a consultant post at an earlier age. Otherwise, you have to work for 2 or 3 years under another neurosurgeon to reach that stage. Unless so, fellowship courses bypasses this.
Okay. All right. Okay, so we have a broad neurospecialty training of if you are directly taking post MBA, so it's either a 5 or a 6 year depending on where you take it, and then usually people subspecialize into a subspecialty with the fellowship course either in India or abroad, right?
Yeah.
So I'll talk about the program. I want to talk about the program at NIMHANS per se because that is one of the options available through INI-CT, this counseling. So how is the neurosurgery program structured at NIMHANS? 6 year, 5 year course.
Yeah. So the fundamental thing about the surgery residency here is that we only have neurospecialties. We have almost 20-30 departments here, but coming to the neuro departments, we have neuroanesthesia, neurosurgery, neurology, then neuropathology, and these are departments which we have. Since we have a limited number of departments, it's a very organized system. The system is very organized. There is absolutely no chaos in the way the hospital functions. So I say like things like ordering blood, ordering investigations, collecting investigation. None of these things require any. Once you join here, you only have to do a doctor's work. You don't have to collect blood samples. You don't have to collect the investigations. All of the things will be documented and informed to you.
Okay.
So that itself, saves a lot of time and effort from your side. So you just have to do a doctor's job when you come here. That is the best thing I like about this institute. There is absolutely no difficulties anywhere in that.
Yeah, I think one of the rare institutes in India where this happens.
Yeah, exactly. You have to run around, wake up in the morning, correct blood samples, correct the barcodes, stick it up and collect the reports, write it down. It consumes a lot of unnecessary time, right? So you can focus more on patient care when it comes to that.
So blood samples are also taken by phlebotomists.
Yeah, everything. They collect investigation. They even inform you the investigations if once they come. So you can manage everything from your phone, via your phone.
Cool.
Most of it.
Cool.
Yeah. So when it comes to the residency, so it is. So that is the first thing I would like to say. It is a very organized setup. So it is a very mature environment. We don't have MBBS courses or any PG courses here. So immediately joining after MBBS is kind of a difficult task because it is a very mature environment. You can listen to people talking about marriage, children, and other things when you directly join here. Because when you join a PG course after MBBS, most of the people around you will be bachelors.
Right.
But when you join here, it happens kind of a shock to you. But then again, it is. The working atmosphere is pretty calm and comfortable because of these issues. You're not frustrated that you're doing something unnecessary or which is not part of your job description. You understood? So then again, the 5-year course, the 6-year course, which is it's a 6-year course.
Okay.
So,
sorry, my bad.
5 years of residency and 1 year of chief residency. So exam will be at the end of your 5th year. So the 6th year has become compulsory now. So you get your degree at the end of your 6th year. So in the first year is basically you don't go to OT. You get to go to OT very less frequently in your first year. So first year is basically ward work and your general neurosurgery experience. So you'll be remaining in the floor. That is how we describe it. You will give rounds every day. So you have to manage patients. You have to learn how to manage patients and basic procedures like basic emergency procedures like intubation, EBD, and external ventricular drain placement, and twisted craniostomy will be the things which you'll be taught. So duty for a post MBBS graduate, when you join, the initial 2-3 months you'll be tagged on with a senior with you. So here what we have is we have 6 units, so you'll be posted to 1 unit. So you'll have some 4 or 5 seniors above you. So you'll be working with 1 senior for 3 months. After that, you will have to start giving rounds. So your work usually starts around 6 o'clock in the morning. So you have to start seeing the patients, take your own rounds. So after that, around 8 o'clock, the academic session starts. So it lasts from 8 o'clock to 9 o'clock. So in first year, residents will not have any academics. So his job is just to do the basic management and inform whatever problems to the senior. There is absolutely no responsibility as a first year. So you work like a dog and don't think. That is what we do in first year. So after that, what happens is first year is relatively difficult in terms of physical work, but in terms of mental stress and everything, it is relatively less because your seniors are always there to help you out. But at the end of first year, you will be posted to Bangalore Medical College General Surgery Department at Victoria Hospital. So that 1 year is kind of a break in between the residency. So you get to learn general surgery and other branches like CTVS, Ophthal and other branches. So that is kind of a break which you get in between the neurosurgery residency. Though that time, if you want to pursue give steps and other things, you can do it during that time. So after that, you will come back to the institute in third year. So in third year, you start going to OT. So here, what we have is every month the unit changes. So every month there are 6 units and 2 emergency teams. So you have 8 possibilities which can happen at the end of the month. So every unit has a different working environment with a different working protocols and everything, and different types of cases. So every month your spectrum of the team and everything changes. So there are around 45 residents are there here with 18 consultants. So you get to work with around almost approximately 60 neurosurgeons. So I tell all my juniors and seniors all together, because it is a gift. It is very important that you get to see your juniors and seniors working, because everyone has a different skill, which is not described in textbooks, or even you will not find it in small videos. So that is the kind of exposure you get. You get to see around 60 people operating. You intermingle with them, intermix with them. You work with a lot of people. Every month the team changes. So you get to learn a lot from of surgical steps and surgical procedure from all of them. So it is not like you remain in one unit and see only one kind of cases. So you get an ample amount of rotation in between. So every year you get around 4 emergency postings, which we call it as trauma posting, which I'm in trauma team right now. So that is like a 1 month posting. So at the end of 1 month, they change the team again. But this 1 month, an entire month, you'll be in trauma, and you'll be managing only, there are 2 shifts, morning shift and night shift. So your working hours will be from 6 o'clock in the morning to 6 o'clock in the evening. So what I mean to say is any emergencies, even on the elective side, will be operated by the emergency team. So hence, this is the only neurosurgery residency program in India where you get to sleep for at least 6 hours every day. So there is no concept of 24-hour shift or 48-hour shift here. So the emergency team manages it they have 12-hour shift. So say I'm in night shift right now. So my evening schedule starts at 6 p.m. in the evening. Tomorrow 6 a.m. My work will go on till 6 a.m. And after handover, I'll get free around 8 o'clock. So from 8 to 9, we have academics, and after that trauma presentation. So I get to free around 10 o'clock. So if I go to my room, I get to sleep for at least 6 hours before I go back.
Right.
The problem is it is very difficult. 6 hours of sleep is the only thing which you get. So after that, you have to come back and work again. So this night shift will last for around 10 days now. So for 10 days, you'll be living the life of a Batman, perhaps. So when I was watching that movie, Batman, I was thinking it's a kind of my life and Batman's life almost similar. I've lost the difference between day and night. It's something like that. You understand?
Right.
But the best thing about it is you get to sleep every day. Even in there is no concept of 24-hour duty over here.
So that way it is pretty structured.
Yeah. So in most of the medical, they have a 24-hour, 48-hour shift. The neurosurgeon is running around like a dog. It is very difficult. Since this 6 hours sleep makes a huge difference in our residency. So once they come back this third year, they start going to OT. In fourth year, they start operating the emergency cases. So in fourth year, 4 months of an emergency posting will be set. You'll be operating around 400 cases of emergency alone, independently, and under supervision. So we have a huge trauma load. And this fourth year neurosurgeon will be operating almost 5 or 6 cases in a 12-hour shift. So that's a huge number. So it is perhaps like right now my fourth year is operating now. He's operating on one side. By the time he closes the skin, the other side OT, another case will be induced for him. His job is just to operate on one side, then go to the other OT, then go to the other OT. I mean, you'll be almost, I mean, E1, M1, V1 at the end of your shift. Still, you get to learn a lot.
Right.
You understood?
So after fourth year, we have the fifth year. Fifth year is the most difficult part of the residency. So unlike other residencies, my understanding of other residency programs are that the third year is the most coolest time of the residency. I mean, your juniors do most of the work and you get time to study. But it is not like that in neurosurgery. Okay. So in neurosurgery, fifth year is very difficult. You will be, here we have present academics sessions from 8 to 9 every day. So this 8 to 9 sessions, you have to present all the operated cases, whether it is emergency or elective cases. So it requires a lot of, I mean, every day you get to, I mean, you have to present in front of the entire faculty. So that we call it pre-op sessions. So that is a difficult, I mean, that is the difficult, I mean, that is one of the difficulties during the residency. Fifth year has to present every day and get holdings and everything every day on a daily basis. So fifth year is very difficult. And final year is, of course, the most difficult part of the residency. So as far as academics are concerned, the academic program is very good. I mean, it is very strict. We have a very good monthly audit of all morbidities and mortalities, and then case presentations every day with journal clubs. So and you get ample time to study also in between, because every year you have 2 months of external posting. So literally you'll be working for 5 months and 1 month break in between, where you get posted in neurology, neuroradiology, and it won't be as hectic as the neurosurgery postings. So you get to spend some time for yourself. And regarding leaves and other amenities, yeah, again, external posting at the time when we get to take leave and go home, and you get some time for finishing your thesis and doing your other activities. But Saturday, Sundays are usually comparatively cool. We have OTs running from Monday to Friday. So second Saturday are off here. So every month you have 5 offs by default.
Oh, nice.
So in most of the teams, except one, most of the units, you have half of the team has to come on holidays. So you get at least 2.5 offs every month.
Okay.
So by default, except when you're in trauma team, you get only 2 offs every month when the shift changes. So that is also kind of decent, I feel, because you don't need to, that day you need not go at all. Your juniors or seniors will take care of the work in the hospital.
All right. Right.
Yeah.
So
that is about.
Yeah, so that was, I think, a pretty good detailed overview of the whole residency program at AIIMS. So just few more questions. So what are the other good neurosurgery programs post MBBS, like other 6-year courses, if you know of any, in your overview and comparison of the same?
Yeah. So AIIMS, NIMHANS and CMC Vellore are the classic 6-year neurosurgery programs in India. Okay. So if I'm right, CMC Vellore was the first institute to start a 6-year neurosurgery program in India. CMC Vellore and maybe Madras Medical College. Okay. So the thing about NIMHANS neurosurgery program is 6-year program is you have a break in between 2 year, second year break for 1 year at Victoria. And the working environment is pretty comfortable at NIMHANS. So we have a huge, I mean, we don't have fellowship programs at NIMHANS, which is good for the residents because we get to scrub directly with the senior consultants from 4th year. Right. So you get to learn from them from a very early age. And there is, despite many, I mean, there has been, despite starting many fellowship programs in neurology, the neurosurgery department faculty has been skeptical in starting a fellowship program because they feel that the learning of the residents will be affected by these fellowship programs because the fellow will be scrubbing with these cases as a first assistant. So that is a benefit of NIMHANS neurosurgery program, which since we don't have fellows, we get to directly learn the things from the consultants. Okay. But AIIMS neurosurgery 6-year program is also a very good course. But one of the problems which people, I mean, I've not run the 6-year course at AIIMS, but my understanding of the AIIMS 6-year neurosurgery program is that they have a huge number of fellows who scrub with cases and huge number of faculty. There are even cases where the senior faculty, assistant professor, fellow, final year resident, then comes the 3rd year and the 4th year resident. So you could become 4th or 5th resident when it comes to a surgery. I mean, that is one of the drawbacks of the programs elsewhere when there are fellowship courses around. So AIIMS also offers a very promising 6-year fellowship course, and it is one of the most glorious neurosurgery programs in the country. and it has produced a lot of best big shot neurosurgeons in the country. Many of them were big shot neurosurgeons outside the country. So it is also a very good course to pursue. Vellore course, they have a very limited number of their intake is very limited, and but still they also many legendary neurosurgeons have been a product of Vellore. So these three are the main 6-year programs in India, and even Srijitra has a 6-year program, but their intake is pretty. I mean, they don't take 6-year candidates very frequently. I mean, right now I don't know about their intake. I mean, 2 years ago they had taken a candidate, so every year they don't find a candidate fit enough to suit the program, something like that. I mean, every year they don't take candidates for the 6-year program, so they basically focus on post MS training.
Right. Yeah. So I'll just talk about a couple of questions more. So what are the future prospects in neurosurgery and the salaries?
Yeah, so neurosurgery in India, there are around right now we have around 2,500 neurosurgeons. Okay, so in cities, the neurosurgery deals with a lot of emergency procedures. So the requirement of neurosurgeons is there is a huge requirement of neurosurgeons in the country. But especially coming to emergency neurosurgery procedures, and it generates a lot of money to the hospital. So you will be tagged on to a hospital throughout your career. It's not like you can independently go and start a clinic and start neurosurgery practice, because neurosurgery setup is a difficult thing to build up, and you will be stuck. You can live in decent cities with a team of neurosurgeons. Will be coming to the future of neurosurgery, especially in functional neurosurgery and endovascular procedures, there are a lot of innovations and things coming up. So the number of there are a lot of new therapeutic interventions which has been invented, especially in functional neurosurgery. So there are a lot of new procedures which will be coming up in the future. And coming to the economics of neurosurgeons, since they deal with a lot of emergency procedures, and most of the neurosurgery procedures require patient admission and long-term patient care. So it itself brings a lot of it generates a lot of income to the hospital as well as to this thing. So it automatically generates a lot of income to the surgeon also. So right now in the country, neurosurgeons are decently paid, and even once you start your practice, there is an exponential increase in your payment depending on the amount of income you generate, your patient load. So, I mean, I'm not sure whether I'm allowed to tell the amount, the salary figures in the.
I think that is fine. We can talk about it. I've discussed this frequently in my channel.
But it's pretty. I mean, for the amount of work which you do, I feel we get decently paid. Okay.
All right.
But maybe in comparison to what you get paid in the West, we get paid less. But yeah, we get paid decent. Yeah, that's what I believe.
All right. So I think that pretty much sums up our conversation about neurosurgery and particular residency at NIMHANS. I think we have covered everything from the branch in general to the program at NIMHANS and the future prospects, salaries, and the academics at NIMHANS, Bangalore. So thanks, Sachin, for joining in with me, and it was lovely talking to you. And you explained everything so in detail, and I really hope it helps the future PG aspirants who are opting for a neurosurgery branch, and it helps them clearing their doubts about this branch. So thanks a lot, Sachin. It was great interacting with you.
Yeah. It was nice to meet you after a very long time, Rishabh. You are one of the most talented, multifaceted juniors which we had. Okay. It's good to see you, see your new venture. Okay. All the best to your future venture.
Thanks, Sachin. Thanks a lot. Means a lot. Thanks.